Okay, good afternoon. Thank you for attending. We're going to start this public workshop. One second. It's 1:04 p.m. So we're going to go ahead and get it started. My name is Chad Westham. I'm an agency manager with the Healthcare Purchasing and Compliance Division of the Nevada Health Authority. Today we'll be accepting public comments for LCB file number R071-26. The workshop will be recorded. Let's see. The small business impact statement regarding these regulations is available on the Bureau's website at www.hcqc.nv.gov. The purpose of this workshop is an opportunity to provide an opportunity for the public to assist with the agency in the formulation of draft regulations. As part of the rulemaking process, the draft regulations will then be subject to a public hearing conducted by the Board of Health. Testimony and written materials submitted during this workshop will be considered during the development phase. In the event your recommendations are not included in the proposed draft of the regulations, you may also present materials or testimony for consideration by the board. If you intend to submit written materials to the Board of Health, those written materials should be submitted to Andrea Rivers, Administrator, State Board of Health, Division of Public and Behavioral Health, 4150 Technology Way, Suite 300, Carson City, Nevada 89706. Materials submitted 15 days prior to a meeting of the Board of Health for which this item will appear on the agenda will be included in the packet sent to the board members for review. These regulations are intended to be heard at the June 5th, 2026 Board of Health meeting for consideration and adoption. As an overview, the Bureau of Healthcare Quality and Compliance is funded primarily by state licensing related fees. Most of these fees have not changed in more than 15 years, even as operating costs have increased significantly. Inflation alone has risen 39% during that time, reducing the Bureau's ability to maintain current service levels. HCQC has also taken on over 10 new unfunded programs, higher salary obligations, and a growing number of required inspections and complaint investigations. To continue providing effective oversight, protecting patients, residents, and the public, a fee adjustment is necessary. These regulations, LCB file number R071-26, address increasing the licensing fees for most facility types licensed under NAC 449 by 7% and increasing monetary penalties within NAC 449 also by 7%. We will now accept public comment regarding LCB file number R07-26. It is requested that individuals turn off cameras and microphone unless you're testifying. Prior to testifying, please provide your name and the entity you represent for the record. So there's a hand up from Carol Fry. Did you want to unmute your microphone and...
Hi, my name is Carol Fry, and I represent Ray of Sunshine Adult Daycare. And I want to respectfully propose consideration of additional license fee category for providers with a capacity of 25 participants or fewer. Currently, providers licensed for fewer than 50 participants, their capacity, are assessed the same licensing fee regardless of whether their capacity is 20 or 49. And as a provider licensed, I'm only licensed for 20 participants. And I believe the current structure places a financial burden on smaller centers whose operating capacity and revenue is significantly lower than the larger providers within the same category. And I understand the need for licensing fees and regulatory oversight, but my concern is not with paying the fees, but rather to ensure that the fee structure more accurately reflects the size and the capacity for the smaller providers. So I am going to respectfully ask the department to consider creating an additional fee tier for providers licensed for 25 participants or fewer. I believe the adjustment will better align licensing costs with operational scale while continuing to support the compliance and oversight requirements. Thank you for your consideration.
Thank you, Ms. Fry. While we're waiting, Claire, is there anyone in the conference room?
No, there's no one here.
Claire, do we have a phone-in line for this meeting?
People can join by phone, but we don't have anybody providing comment. I do see a hand up now.
Okay. Mr. Grosh, go ahead.
Okay. Good afternoon, members. My name is Brian Grosh. I represent Nevada Valley Home Care, Inc. We are a provider of long-term care for seniors, primarily memory care and dementia. We also provide care for a two-bed facility for those that have higher level of needs. I would like to see if we can propose increasing that capacity from two beds to 3 beds. And if the fees were to go up, but if that's something that we can consider for the June 15th meeting.
Thank you, Mr. Grosh. Did I missay your name?
No, Chad, it's Grosh.
All right. Very good.
Perfect.
Thank you for your comment. I've got staff in this meeting that also heard that, and I'll ask one of them to get back to you after the meeting.
Appreciate it. Thank you.
Thank you. Okay, we'll give it a couple more minutes. Claire, is there others wishing to join on another modality or in person?
We don't have anybody here, and no one's emailed any written comments either.
Okay. All right, we'll wrap up. We'll give it a couple minutes and then wrap up about 1:16 p.m. if there's not any further comments.
Can I ask one more question?
Sure, Mr. Grosh.
Does the scope of this, and forgive me if I missed it, but does the scope of this also allow for the increase in fees that we bill for Medicaid, or it's only the fees for HCQC?
Yeah, this the purpose of this meeting is to take comments, but to answer your question, this is just for the fees charged by the Bureau.
Got it.
It does not include the CMS Medicaid fees you're speaking of.
Okay. And would increasing capacity kind of fall under this umbrella or not necessarily?
I know that's why I'm going to have staff get back with you, because
Got it.
it's really very simple across the board, 7%, unless there's a statutory prohibition otherwise.
Okay.
Yeah. Thank you. Excuse me. Please go ahead if there's further comments. Okay, Claire, any in person or any in person people wishing to make comments or on the phone or that you see otherwise?
No, I don't see any other comments.
Okay. All right. Well, thank you for everybody who joined this workshop.
Chad, it does look like we do have another hand now from Carol Fry.
Yeah,
Oh, okay.
I just want to verify where we send the information to. Is that posted on the notice, or because you kind of went through the address of where we can send mail our information, and or is it in the chat?
I can answer here, Chad. On the
Yeah,
agenda there on
please.
the screen, and on the notice, it says if you wish to provide written comment, you can submit those to the email at pio@nvha.nv.gov. Again, pio@nvha.nv.gov.
Thank you.
All right. Any final comments? Okay, well, thank you again for everybody who joined us. And please reach out, send an email, or give us a call if you have further questions or comments. And this concludes this workshop meeting.